Today we'll be discussing the special senses. So when we say special senses, it has something to do with the sense of touch, the ear, the hearing, of course the sight, the taste, and of course the smelling. So those are the special senses. So special senses are those regulated by the cranial nerves and are of general interest for practitioners of anesthesia and of course the intensive care. So why are special senses special? They are special because each sense has its own or special pathway to the central nervous system. So what are the functions of those special senses? Of course, for vision, sight or vision, the capability of the eyes to focus and detect images of visible light on photoreceptors in the retina of each eye that generates electrical nerve impulses for varying colors, hues, and of course brightness. And another thing is of course the hearing or the auditory is the sense of sound perception. So this one is very much understandable, right? Then taste refers to the capability to detect the taste of substances such as the food, the certain minerals, and of course the poisons, etc. What about the smell or the olfaction? Is the other chemical sense. Other molecules possess a variety of features and thus excite specific receptors more or less strongly. This combination of excitatory signals from different receptors makes up what we perceive as the molecules smell. And last would be the touch or the somatosensory, also called the tactile or the tactician or mechanoreception, is a perception resulting from activation of neural receptors, generally in the skin, including of course the hair follicles, but also in the tongue, throat, and of course the mucosa. So I won't be dwelling anymore with the anatomy of these different special senses, because this one, what we're dealing or what we need to discuss for this subject matter is of course the skill that we will be doing in connection of course with these special senses. So we will just take of course the first one, which is the vision. So what is the skill that we need to do with regards to the vision? Of course, as nurses, we need to do the eye assessment. So this one is a way to gauge the patient's eye health. So you'll generally perform a nursing eye assessment as part of your head-to-toe assessment. Kasi as you will notice, if you will be performing the head-to-toe assessment, part na siya na may assess ninyo the sense of sight. Okay, so what are we going to prepare in performing or in doing the eye assessment? Of course, you will be needing the pen light. Then the procedure will be, of course, in any procedure, don't forget to do the hand washing. Then ensure, of course, the privacy of the patients. So anyway, this one is a simple procedure. So if the patient can do, if you can do it, the simple procedure, that even there is someone who is looking at you, or as long as the patient is not wearing anything that would that would encourage any persons with regards to her outfit or what. So that's it. So if it's just in a formal way of wearing his attire, so no problem, you can do the procedure in a very good way. Okay, only anyway, this one is only an eye assessment. Then another thing is of course you need to do the self introduction. So in any procedure that you will be doing, you need to introduce yourself and you need to explain the procedure that you will be doing with your patient. Then identify the patient using the identifiers. Of course, aside from the while checking for the ID band of the patient, you need to ask for his name and of course his birthday. Then you need to position the patient in a comfortable position. Then what is the next procedure that you will be doing? So you need to inspect for the eyes of your patients. Look for the eyelids. So there should be no swelling and the sclera should be white and shiny and not jaundice, of course. And the iris and even the pupil and the conjunctiva should also be checked or assessed. Then you need to pull down the lower lid. and ask the patient to look. Okay, to look up. Okay, so pull down the lower lid and ask the patient to look up. Then it should be pink and not red, and of course there should be no discharge. What else? Look at the eyes. How do they set in the eye set? Are they equal? So that's the time that you will notice if the patient is having a strabismus. So when we say strabismus, it is a cross-eye. Okay? So aside from that, you need to check as well. Look at the pupils. Are they having the equal size? So we term it as anisocoria or anisocoric. So meaning where one pupil would be smaller than the other. So normally the pupil size would be 3 to 5 millimeter in size. That's the normal size of the pupil. Then assess for some cranial nerves. And what are those cranial nerves that we need to we can also check in doing the eye assessment? Of course, we have the cranial nerve 3, which is the oculomotor, the cranial nerve 4, which is the trochlear, and of course the cranial nerve 6, which is the obtusans. Then check also for the nystagmus. So when we say nystagmus, it is the involuntary shaking of the eyes. So how are we going to check that? By holding, of course, the pen light 12 to 14 inches away from the patient's nose. So here's the patient's nose. So the examiner should be there 12 to 14 inches away from me because I am the patient. Okay, the examiner will be there away from me. Then instruct the patient to keep his head still and just follow where the examiner positioned the pen light. So it strictly inform or instruct your patient not to do anything, any movements. So he will just be looking at what you are doing as a nurse or the examiner. Okay, so she will just look at the pen light and that's it. No more movements. He will not turn his head or whatever. He will just look at the pen light. Okay, or what is being given, or what is the instructions being given to him by the examiner. Then perform the 6 cardinal fields of gaze. Move it and look for any involuntary movement of the eyes. So okay, so sabi dito 6 cardinal fields of gaze. So from the video that I will be showing you later on, so if the examiner is pointing the pen light up, so the patient should be looking up. Okay, so she need to position his eyes like that. Okay, and if the examiner will be pointing the pen light on the right side, the eye should be looking like that. Okay, she should be staring like this. Okay, without moving the head, only the eyes. Then check for the pupillary reaction. So how are we going to check for the reaction? So the first thing is pupillary reaction. So you need to dim the lights. Then instruct patients to stare off at a distant object to help him dilate his pupil. Okay, so instruction would be turn off the lights, then ask the patient to stare off on the distant object so that his pupil will dilate. Then as an examiner, turn on the pen light and lit it from the outer to the inner. Okay, from the outer to the inner. So while looking at the distant object, you will see that the pupil of the patient will dilate. So meaning, kapag sinabing dilate, medyo lalaki siya. Okay? Kapag nakatingin siya dun sa malayo at nakadim light pa. But the moment that you pass through the pen light from the outer to the inner, makikita nyo what would be the normal reaction. So the normal reaction should be both pupils will constrict and equal in size in doing this procedure. So once you pass through the pen light from here up to this one, okay, here up to here, then here up to here. So dapat yung kanyang pupil will constrict, liliit siya. So dapat once the pupil will constrict, dapat yung size nun dapat parehas on both eyes. Then the next thing that you will be doing is to check for the accommodation. So this time around, accommodation, if before we turn off the lights, this time we will turn on the lights. Then repeat the number 15 instruction. which is instruct patient again to stare off at a distant object to help him dilate his pupil. Okay, so same thing. Turn on the lights, but this time it's turn on the lights, then let him stare on the distant object. Then instruct the patient to follow your direction again. So what you will be doing is instruct him na, sir, I will examine again the eyes. So what you will be doing is to stare here with my object, which is the pen light. Then you will just follow the pen light. Okay, the instructor is to follow the direction of the pen light, then hold the pen light. So if the examiner is there, hold the pen light and slowly move it towards the patient's nose. So normally the reaction would be, if the pen light would be approaching the nose of the patient, normally the eyes of the patient will accommodate on one direction, only to this pen light. And of course, both pupils will also constrict. Then after that, you will do your documentation. Then, if it's normal, of course, the result would be PERLA, which stands for the pupils equal, round, reactive to light, and of course, accommodation. So that would be needs to be documented on the patient's chart. But then, if there would be any abnormalities with regards to your eye assessment, you need to take it down or have it written on the patient chart and refer it accordingly to the attending physician. Okay, so that's it for today. And by the way, please you may use the video presentation that I'll be posting on the FB group for you to have a guide in doing your eye assessment. Okay, so you will just be focusing on the eye assessment, and that eye assessment then will be submitted on May 13th of this year. Okay, so thank you very much and hope to see you by next week. By the way, I forgot to inform you that these are the visual presentation that you need to see if you'll be having if you'll be doing the eye assessment. Of course, in checking for the eyes, you need to check if there is eyelid swelling, there is a sweat jaundice, wherein you can see the yellow discoloration of the sclera, and of course the erythema. So if those abnormal things, you need to note that one on the patient chart. And of course the anisocoria, the unequal size of the pupil, and of course the strabismus, wherein it is being also called as crossed eye. Okay, so those are the abnormal things that you can see from your patients that needs to be documented. Okay, so thank you very much and hope to see you by next week.